Excuse me. In PNG, we have so many TB cases, yet we forget to believe in the medical knowledge, and we always believe in the customary and the socially related thing. In that regards, we have many social issues that is still a nightmare to our people back in the rural areas in the Papua New Guinea. So this awareness, I am trying to bring it across the whole nation, Papua New Guinea. It is all about TB awareness. As you can see, tuberculosis remains a major public health concern worldwide, causing a significant morbidity and mortality death within the country and even out of the country. And for your information, the most common leading deaths in Papua New Guinea is TB. That's the number 30 in our country. As such, this presentation will explore the complexity of this infectious disease, from transmission and risk factors to diagnosis, treatment, and prevent strategies. So please go with me during this presentation. As you can see, tuberculosis is an infectious disease that is an airborne disease. TB is a contagious disease caused by Mycobacterium tuberculosis bacteria. Primarily, TB tuberculosis affect the lung. That's the most common area where it does affect, which affect the respiratory tract infections. Well, TB is treatable, but it is very challenging with the treatment that you will take daily. While TB can be treated with antibiotics, the rise of the drug-resistant strains pose an ongoing challenge with the public health in Papua New Guinea and even throughout the world. As such, it is a global health concern. TB remains a significant public health issue, particularly in developing countries with the limited resources like us Papua New Guineans. So this awareness will can help those who cannot reach. So whoever is listening or whoever come across this video, please get this information straight, and then you disseminate to our friends, families, relatives back at home or wherever they are. Transmission and infectious dynamic of TB. First, it is an airborne transmission. TB is primarily spread through the air when an infectious patient coughs, sneezes, or speaks. The saliva or the bacteria that are along the respiratory tract infection in the mouth, it transfers easily when we talk. So, like, if you are a suspect of someone having tuberculosis, you better talk without facing them or confronting them. You can talk like watching this way, and the other fellow watch that way. Two can communicate. Or you wear mask. The mask is not about COVID. We've got other common diseases, endemic diseases within our areas, which they live within us. So this is how TB is transmitted. Also, number two, TB can be transmitted to close contact. Like people living in a closed, prolonged contact with an infectious TB are at higher risk of getting TB. As in my previous video I shared, if one patient is having TB and is left untreated, he or she can give TB to other 15 within the households. So this is how dangerous the TB is. Number three, latent fish, which some people may have a latent pest tuberculosis while the bacteria remains dominant and do not cause active disease. Like you can be a carrier, your TB will be there, but it will not show out. Some years or months later, uh, it will show you with some signs and symptoms. And the reactivation phase. Latent infection can reactivate, especially in individuals with weakened immune system, in the likes of a HIV patient. When we have a HIV patient, we usually say they got married together. TB and HIV go together. Why? When the immune system of the HIV weakens, TB get him easily. So that is why if you have a patient, you are suspect of a patient or a patient is a HIV positive, you must always think of a TB. So they go together, they are coupled. One has to present. Some way it will still come in. So this is how it goes. Risk factors and vulnerable people of patient or people having TB are the weak immunity, as I've said, like TB, HIV, they go together. Those who have HIV, TB can easily get in because the immune system is weakened. By the way, HIV does not kill patient. Other opportunistic infection does kill patient when the immune system get weakened. That's how HIV death occurs. But like many used to think that the HIV does cause death, but it doesn't. HIV only weaken the immune system, and the other opportunistic infections get into the immune system, and then it weakens everything and kill the patient. So HIV only weaken the defense, the fence around or within our body. It weakens, and other diseases get in when the system is weak. That is why those illnesses kill patient, not HIV kill patient. So get that fact right. Also, substances abuse like smoking, alcohol, abuse, and drug use can increase the risk of TB infections and disease progress. So why would I say that smoking and alcohol? When a patient puff or smoke, it just directly get into his or her mouth, and then you change that saliva in the TB patient with the non-TB patient. You just directly getting the TB bacteria. That is how the risk is about patient smoking, sharing smoke, chewing betel nut, sharing alcohol, like you chew together, share together. These are some of the common areas that you can easily get TB. So get to know the substances that can cause your life. And the other thing is the poverty and the overgrowth of the population. Like we've got so many people you cannot feed. Many are malnourished, vulnerable. Very sad, huh? But like for us Papua New Guineans, we have good landmass that we can cultivate, but we don't do that. We are lazy people, so that is why most of our people are vulnerable to TB and other illnesses, which poverty leads. So it is very sad. And the number fourth risk factor is the aging population. Those elderly who are aging, their immune system are weakened, so they are likely easily they can get us TB. That is why aging people needs to stay away from those who are suspect of having TB. But the fact is that if someone is on a TB medication, she cannot really easily pass TB while she is on treatment or he is on treatment. But those who are not on treatment, they are very risky and they are at high risk to transmit or spread it to other uh, households, people around or within their house. Symptoms and the stages of TB. The early stages I would say like coughing, chest pain, fatigue, fever, and unintentional weight loss are commonly early signs of active TB. As cough, when you have a productive cough for more than 2 weeks, even though you get treated, but the treatment, the antibiotic doesn't help. So the only way that you have to do is you rule out for TB, do TB test, something like that. Then you've got a chest pain, fatigue, you're feeling malaise or you're feeling weak, nauseated, you're having eye fever, and you're having weight loss without you realizing it, just unintentionally. These are some of the early signs of acid TB. If you have it, please seek medical assistance ASAP. And then the latent phases. As the disease progresses, symptoms can worsen, including the severe cough, coughing up blood, and the respiratory distress, like you presenting with a shortness of breath. When you try to climb a hill, you will find it difficult to climb hill because your lung has been affected by the bacteria, the TB bacteria. And then in the alveoli, it does form uh, fluid which it accumulate and then from effusion, which is pleural effusion, that can lead you to shortness of breath. And then when you continuously cough for almost 2 to 3 weeks or a month or even so, you will have a bloody cough. So that's the latent piece. And the latent infectious is individual with a latent TB infectious may not exhibit any symptoms but can still transmit the disease to others, which this is very dangerous. Take that note when one patient has sick TB, he or she can give it to 15 people within the house. That is how the dangerous the sick TB is. And then the active base or active disease TB. Active TB disease occurs when the immune system is unable to control the bacteria, leading to development of the symptoms and the potential of transmission. As I've said earlier, when you are not treated, you have the highest risk of transmitting to other people. And one TB patient without getting treatment can give TB to 15 people within the house. That is how dangerous the TB is. Okay, then we go to the diagnosis and the testing procedures. For in order for you to diagnose a TB patient, you have to do a proper physical examination. When you do a physical examination, you will notice that they've got a lymph nodes around here, like rubbery, non-tender, like a marble around your jaws, clavicles, and the axillary areas, which is a clear sign of tuberculosis, where the immune system is trying to fight against the bacteria. That is why the immune system reacts and it forms those lymph nodes. But on the other way, there's also TB in the lymph nodes that it has affect. So which is called extrapulmonary TB. So the thing that you will do is you do physical examination. You do chest examination, front and back. When you inspect inspect for any abnormalities, any swelling, any deformity, and then you examine the percussion, palpation, and auscultation. You listen to the lungs, the air entry. Is there any abnormal reduced air entry or the increase in the vocal sound or reduced chest expansion? These are some of the physical examination that you will notice while doing the examination to a TB patient. And then number two, testing, diagnosis, and testing procedure is imaging test. Imaging test or doing a chest X-ray, which reveal abnormality in your lungs that a doctor or a clinician can interpret that X-ray. And the number third testing procedure is collecting of sputum. They will give you 2 cups of sputum where you will put your spat in, and then in the morning hours you will bring it to where they collected the sputum, especially to the health facility or the hospital, so that they can save bacteria in that saliva. Blood testing is done for like full blood examination for any neutrophils, eosinophils, all increase in react to the immune system. That is why they do blood tests and other tests to rule out for other diseases as well. And then, well, we go to the treatment. Management of tuberculosis is a drug regimen with a full dose combination, which is FDC, full dose combination. They will start you off with initial intensive phase, which 2 months. According to the weight, they will give you TB drugs. That is for less than 6 months within the pulmonary. They will give you 6 months treatment regimen. But extra pulmonary, it will be either. But then if it is a multi-drug resistant TB, they will give treatment to more than a year, which you will get injection every day. So for the pulmonary TB, they will give you 6 months, and the first 2 months is called intensive phase. After you completing intensive phase, another 4 months you will go for continuation phase. For continuation phase, some drugs will be reduced, while intensive phase they will be increasing drugs. So some of the side effects of you getting TB drugs, like urine, you will see the color of the urine and the fishes. It will be reddish. That's normal, nothing else. And then you will have some rashes around on your body, and then your eye will have some side effect of the sides, which it goes away, but then you have to seek immediate assistance if it's continuous motion. But those prescribers, TB prescriber, drug prescribers will explain to you on that regards. So this is the presentation of how TB is managed. Then I would like to talk on the preventive method of tuberculosis. As we said earlier, early detection is better than we wait for the longer. And then infectious control. Those who have TB already, we do our house contact tracking. Like all the household within the family has to be checked for TB. That's a preventive method. And the other thing is vaccination, which is the very important part for babies. Babies who are born, they have to get a BCG, which it does protect tuberculosis, and leprosy. As you can see on your left hand side, you will see a scar on your left hand side. That is where you was given or administered BCG, which to prevent tuberculosis, TB, and leprosy. And then the final one is public health initiatives like health awareness, integrated health awareness with the school, the NGOs, the church, marketplace, the public places, the radio, the media. This will reduce the burden of us having TB and reduce the leading cause of death within our country. If this information helps you and you want us to improve on further, or you want us to talk more about, please drop in your comment below so that we improve on that. Thank you all for watching.